Good morning, everyone. My name is Kenny Wu, and I'm the program coordinator here at Well CTSC. Thank you, everyone, for joining us today. This is our fourth presentation on the diabetes. And today we're joined by Ruben Diaz from the Hospital of Special Surgery. This presentation will be done in English and Spanish. If you want to ask a question or you want to talk to the presenters, there's this chat function at the bottom of the screen. You can type in a question and the presenter will answer your question during the Q&A section of the presentation. At the end, we'll have a short poll about today's presentation. Please fill it out if possible. Muy buenos días, mi nombre es Kenny y yo soy el coordinador de programas en Well CTSC. Muchas gracias a todos ustedes por atender nuestra presentación el día de hoy. Vamos a tener una presentación sobre diabetes. La presentación va a ser en inglés y español. Si tienen preguntas, en la parte de abajo hay una sección para preguntas en chat. El presentador del día de hoy es Rubén Díaz del Hospital for Special Surgery. Al final vamos a tener una encuesta sobre la presentación. Por favor, llénenla si pueden. All right, Rubén.
Good morning. I'm Ruben Diaz, nurse practitioner, diabetes at Hospital for Special Surgery. I'm presenting the fourth part of the diabetes presentations. This is Mind Your Diabetes, Diabetes and Mental Health. Mi nombre es Ruben Díaz, yo soy practicante de enfermería en el Hospital de Cirugía Especial de Diabetes, presentando hoy parte 4 de las presentaciones de diabetes. Ponle mente a su diabetes, es sobre diabetes y salud mental. So Hospital for Special Surgery, it's a specialty hospital for orthopedics and rheumatology, #1 for orthopedics, #3 for rheumatology in the nation. It is a magnet-recognized hospital for nursing excellence. Our mission is to provide high-quality care, improve mobility, and enhance quality of life for all. El Hospital de Cirugía Especial es especializado en ortopedia y reumatología. Es #1 en ortopedia y #3 en reumatología en la nación. El programa es reconocido por Magnet de excelencia de enfermería y la misión es proporcionar atención de la más alta calidad, mejorar la movilidad y mejorar la calidad de vida para todos. So thank you for attending today's session. At the end, again, Kenny emphasized the short survey that will be provided. They are anonymous and it'll help to improve our future sessions. So if you can fill it out, we would be grateful. Gracias por asistir a la sesión de hoy. Como avisó Kenny, al final de la clase le pedimos que llene la encuesta. Nos ayudará a hacer los programas mejores en el futuro y también dejarles saber que es anónima y nos ayudarán a mejorar las sesiones, como había dicho. Today's objectives are to create awareness about depression versus sadness, the link between diabetes and depression, and learn about the difference between depression and sadness and how it affects people with diabetes. Los objetivos de hoy es crear conocimiento entre la depresión frente a la tristeza, cuál es la relación entre diabetes y depresión, y conocer la diferencia entre depresión y tristeza y cómo afecta a las personas con diabetes. So feeling sad, feeling blue, there are different names for it. It is a common emotion to the human experience. It usually occurs related to something else, so a painful circumstance or loss. It's temporary, it lasts a few days. There are ups and downs where you may feel better or worse, but it does not severely impact your quality of life or general ability to function at work or at home or socially. You're still able to perform your job duties. You're not calling out as a result or canceling plans with friends. Rarely accompanied by physical symptoms and does not require specific treatment. La tristeza, sentirse triste o bajo en ánimo, hay diferentes maneras de decir cómo uno se siente, pero es una emoción común para los seres humanos. Generalmente ocurre a pesar de algo que ha ocurrido, sea una circunstancia dolorosa o pérdida. Si es temporal, dura solo unos días, hay momentos altos y bajos, mejores días y peores días, pero no afecta severamente la calidad de vida o la capacidad de trabajar, de hacer los quehaceres en el hogar o socializar con personas. En sí no estás llamando enfermo y no participando en el trabajo o cancelando planes con amistades. Raramente la tristeza es acompañado de síntomas físicos y no requiere tratamiento específico. Depression, depresión, es diferente. Depression is different. It is a serious medical condition. It is diagnosed. It is a medical condition. Symptoms persist for longer than at least 2 weeks. So it'll be 2 weeks or longer where those feelings that someone may have identified themselves as sadness continues on. This is when it actually becomes chronic. Accompanied by physical symptoms. So you can have physical symptoms of just feeling fatigued, tired all the time. There can be pain, like just really not well identified muscle pain, changes in sleep patterns and or appetite. So you could either be sleeping more than usual or less than usual, and you could be eating to feel better or just not eating at all because the depression just takes your hunger away. La depresión es una condición médica seria, es diagnosticada, es una condición médica. Los síntomas persisten por lo menos 2 semanas. So, cuando quizás una persona pensaba que era tristeza, ya a través de haber pasado 2 semanas o más, si ese sentimiento continúa, se clasifica más hacia la depresión. Y muchas veces es acompañado de síntomas físicos. Puede ser cansancio, sentirse fatigado, dolores musculares que uno no puede identificar bien de dónde provienen y cambios en los patrones de sueños y de comer. Puede ser que está durmiendo más de lo normal o menos, igualmente comiendo, vamos a suponer, más para sentirse mejor o igualmente sentirse en tanta depresión que no tienes hambre. Depression, in depression, there's changes in thinking about oneself, negativism, guilt, worthlessness, death, and can even lead to suicide. It does have a negative impact on life, the quality of life, and the general ability to function the day-to-day activities. Without treatment, these symptoms can last for weeks, months, or even decades. La depresión también hay cambios en el pensamiento de sí mismo, negativismo, culpa, inutilidad, sentirse inútil, muerte, desear uno estar muerto, e incluso pueden llevar al suicidio. Tiene un impacto negativo en la calidad de vida y la capacidad general para funcionar. Sin tratamiento, esos síntomas pueden durar días, semanas, meses e incluso décadas. I wanted to address some depression myths. Quería hablar sobre mitos de la depresión. In depression myths, it is not true that depression is the same as sadness. It is not the same. The thought that being depressed means being weak, that is not true. It takes a lot for a person to manage depression. It is not for the faint of heart. So there's by no means is someone who is depressed same as being weak. Depression can be cured by just willing yourself better. That is not how it works. Depression is crying all the time. That is not true. And that goes with the line that people who are depressed do not smile. Oftentimes I've heard of someone committing suicide and people close to them saying, I wish I knew so that I could have done something. So that goes with, you may not even know because they can smile the way through it. So it's dangerous and it's important to recognize that. El mito de depresión, no es cierto que la depresión es lo mismo que tristeza, no son iguales. Estar deprimido significa ser débil, eso no es verdad. Estar deprimido en esa condición clínica requiere mucha fortaleza para sobrellevarlo y no es para las personas débiles, las personas son fuertes. La depresión se puede curar solo por uno mismo querer uno mismo estar mejor. No, eso requiere más cuidado avanzado. La depresión es llorando todo el tiempo, eso no es verdad. Igualmente, eso va con el dicho que las personas deprimidas no sonríen. Tampoco es verdad. Hay personas que han cometido suicidio y yo he hablado con personas acerca de ellos, cercanos de ellos, que han dicho yo quisiera haber sabido que la persona se sentía de esa manera para yo poder haber hecho algo. En eso usted puede ver que las personas con depresión pueden esconder cómo se sienten y es importante reconocerlo. Signs and symptoms of depression. So I wanted to go over some of them because they may overlap the symptoms of diabetes. Los signos y síntomas de depresión quería repasarlos porque algunos síntomas de la depresión se superponen con los síntomas de diabetes. So the signs and symptoms, it's an emotional state that is persistently, let's say, sad, anxious, or someone saying it's like a feeling of feeling empty, a feeling of hopelessness or pessimism, guilt, useless, or sense of loss, loss of interest or pleasures and activities that they once enjoyed, loss of energy, fatigue, exhaustion. So this is highlighted in bold and red because that is a symptom that overlaps with diabetes. En un estadio emocional que es persistentemente triste, ansioso o vacío, es un síntoma, un signo de depresión. Sentimientos de desesperanza o pesimismo, de culpa, sentirse inútil o sensación de pérdida, sentirse vacío. Pérdida de interés o placer en actividades que antes disfrutaba. Y últimamente pérdida de energía, fatiga y agotamiento. Y está notado en rojo porque es un síntoma que se comparte con diabetes. Also, difficulty with concentrating, memory and decision making. Sleep disturbance, this is one of the symptoms of depression that also overlaps as a diabetes symptom. So it could be insomnia, not being able to sleep, or waking up earlier, sleeping longer, more than usual. Appetite and weight changes, that is also with diabetes and depression. It can increase or decrease, as we spoke before. Irritability and restlessness. So these can be symptoms of hyperglycemia or hypoglycemia. It can be a symptom of depression. Thoughts of death or suicide, suicide attempts, that's particular to depression. Otra vez, otros síntomas de depresión, dificultad con la concentración, la memoria y la toma de decisiones, trastornos del sueño, se superpone la depresión con diabetes, ellos comparten ese síntoma. Insomnio, no poder dormir, levantarse más temprano, dormir más o más de lo habitual. Apetitos y cambio de peso, esto sucede con depresión y diabetes, aumenta o disminuye en ambos. Irritabilidad e inquietud se comparte con diabetes y depresión, y pensamientos de muerte o suicidio, intentos de suicidio, es principalmente de depresión. Want to make a connection between depression and diabetes. Quiero hacer la conexión entre la depresión y diabetes. So it's not clear how diabetes and depressions are linked, but there is a connection. And depression is 2 to 3 times more likely in people with diabetes than the general population. This is well known and documented. No está claro cómo está relacionado diabetes con depresión, pero sí existe una conexión. Y la depresión es 2 a 3 veces más común, probable, en personas con diabetes que en la población general. Y esto es bien documentado y se sabe. Depression and diabetes. So any chronic illness at all, it could be depression, it could be asthma, something like hypertension. Any chronic illness increases risk of depression. But the correlation with diabetes is very strong. Given the risk of complications that are associated with diabetes over time, just the risk of it, and the lifestyle changes, the nutrition, the physical activity, it sometimes people feel like it dominates their day-to-day that people with diabetes must make. There are elevated depression symptoms, this is documented, and depressive disorders that affect 1 in 3 people with diabetes who are on insulin, and those not on insulin with type 2 diabetes. Elevated depressive symptoms are found in 1 in 4 people. And in type 1 diabetes in general, depressive symptoms are found 1 in 5 people. Depresión y diabetes, cualquier enfermedad crónica, sea asma, presión alta, diabetes, todas aumentan el riesgo de depresión, pero la correlación con diabetes es fuerte, dado al riesgo de las complicaciones que pueden ocurrir con diabetes y los cambios en el estilo de vida que hay que hacer para manejar diabetes, sea cambios en comer, ejercicio, son muchas cosas y las personas se sienten como que toman control sobre su día diariamente. Los síntomas depresivos elevados y trastornos depresivos afectan 1 de cada 3 personas con diabetes tipo 2 que inyectan insulina o tratados con insulina. La decisión de inyectar es una propia. 1 de cada 4 personas con diabetes tipo 2 no tratada con insulina se encuentran síntomas depresivos. Y en diabetes tipo 1 se encuentra 1 de cada 5 personas con síntomas depresivos elevados. Depression and diabetes. Diabetes can cause the following emotions: challenges concentrating on treatment regimens, stress due to the demands of daily treatment that I was alluding to before, worry over those long-term complications, the cost of treatments, the effect that diabetes has on family and work life. It could be as simple as having to change your meals as opposed to what the rest of the family eats. Even just feeling that it's just too much work to track your blood glucose levels and just choosing and eating healthier foods and the timing of foods, it can be pretty overwhelming. And sometimes it feels like too much for a person with diabetes, and this can lead to depression. La diabetes, depresión y diabetes, la diabetes puede causar las siguientes emociones: desafíos para concentrar en los regímenes de tratamientos, estrés debido a las demandas de tratamiento diario, preocupaciones otra vez por las posibilidades de complicaciones a largo plazo relacionado con diabetes, los costos y el tratamiento médico, cuánto me van a costar las medicinas, los efectos de la diabetes en la vida familiar y laboral, comer comidas, quizás tiene que preparar una comida distinta al resto de la familia y se siente diferente a la familia. Sentimientos que es demasiado trabajo para hacer un seguimiento de registrar sus niveles de glucosas a diario y tratar de elegir alimentos más saludables, qué voy a comer, cuándo voy a comer, cuánto puedo comer. Es mucho y a veces cuando se siente como demasiado, las personas se pueden deprimir. Causes of depression and diabetes, causas de depresión y diabetes. So some of the causes can include acceptance of diabetes. Many of the symptoms such as sadness and irritability are emotional challenges that are common to people with diabetes. And they often come from sometimes the inability to accept the diagnosis. This doesn't only affect the person, it can affect family and people around them in general, since it isn't easy to learn to live with someone with a chronic illness sometimes. Causas de depresión y diabetes, una puede ser aceptación de la enfermedad, de la diagnosis de tener diabetes. Muchos de los síntomas como la tristeza y irritabilidad son desafíos emocionales comunes entre personas con diabetes y provienen a veces de la incapacidad de la persona para aceptar su enfermedad. No solo afecta a la persona con diabetes, pero también a la familia, y solo tener que aprender a vivir con alguien con una enfermedad crónica no es fácil para todos. Another cause of depression and diabetes, I say causes, but I would say more an association, development of the illness. So it's important how the person adjusts to the changes once they have a diabetes diagnosis, of what must be done in the lifestyle changes, and just thinking back about what may have led to the illness. Some people can have feelings of guilt surrounding that. Causas de depresión y diabetes, otra vez, yo digo causas, pero simplemente puede ser una asociación, el desarrollo de la enfermedad cómo la persona se adapta a los cambios que se deben de hacer en su estilo de vida y cosas que pueden haber llevado a la enfermedad. A veces las personas se sienten con culpabilidad pensando que quizás han hecho algo que pueden haber llevado a la etapa de diabetes. Also, contributors to development of emotional challenges includes possible complications of diabetes, difficulty in sticking to a diet, and controlling blood glucose levels. So, otros contribuyentes al desarrollo de desafíos emocionales incluyen posibles complicaciones de la diabetes, dificultades en seguir una dieta y control de los niveles de glucosa de sangre. Causes of depression and diabetes that have been identified, the biochemical relationship. So this is where it goes back to, this is a medical condition. It is not like sadness, where it's common across the entire human condition. Some research has found the relationship between diabetes and depressed persons and a high level of stress hormone called cortisol. This hormone can cause a person to be less sensitive to insulin and may increase fat deposits around the waist, which is one of the risk factors for diabetes. Under conditions of stress or diabetes, the pancreas produces less insulin. So it's like being in a constant state of stress, being in a state of depression. So, otra causa de depresión y diabetes que ha sido identificada, relación bioquímica, es porque estaba hablando antemano que es algo, depresión es una diagnosis médica. No es como la tristeza, que es una condición que es común al ser humano. Algunas investigaciones han encontrado una relación entre diabetes en personas deprimidas y un alto de la hormona que se llama cortisol, que se presenta en estrés. Un alto de nivel de esta hormona puede que la persona sea menos sensible a la insulina propia y puede aumentar los depósitos de grasas alrededor de la cintura, que es un factor de riesgo para la diabetes. En condiciones de estrés o depresión, el páncreas produce menos insulina. So next, I'm just going to show you a video of challenges of living with diabetes.
This is the reality. This is what you'll have to do.
4.7 million people are living with diabetes.
I am one of them.
I am one of them.
My son is one of them. Diabetes is hard to get to grips with.
My experience of living with diabetes
It's different to yours.
managing the regular appointments. I'm a bit nervous.
It never goes away. It's relentless.
Every choice I make,
The food I eat,
the pace I walk,
even the weather, are going to affect me. It's constant adjustment,
Frustration,
restrictive,
resentment,
inconvenient.
worry,
exhausting.
no time off every single day.
Diabetes is not just a medical issue.
Your emotional tank runs out very easily when you're giving care constantly. What I would like to see would be psychological well-being support and actually recognition that looking after mental health is equally as important as the physical health needs.
My doctor's practice is wonderful, but I don't think they had the time to be able to sit down with me and say, how do you feel about it?
Emotional support would be very useful because we'll break at some point.
I'm disappointed. I'm angry.
About you as a human being, your whole person. You talk about it earlier. You're more able to manage it. You're more able to face up and own it.
So it's really just focusing on what did the video say. It's just showing many people, different people, struggle with diabetes across age, race, ethnicity, everything. It's everyone that has diabetes, but it's not something that's not manageable. And also with the depression, seeking help early. And we're going to talk about in the following slides things that we can do. We all need help, no matter what chronic condition we may have. El video nos informa que muchas personas diferentes luchan con diabetes y con salud mental. Puede ser cualquier raza, etnicidad, hombre, mujer, niño, adulto. Muchas de las personas simplemente es importante decir que deben de buscar ayuda y no hacerlo solo. So why is it important to communicate with your healthcare provider to treat depression? To talk to your healthcare provider about how you feel so that you can find a solution as soon as possible. Diabetes that is poorly controlled may cause symptoms similar to the symptoms of depression. So not diagnosing yourself, actually having the conversation with a provider. Blood glucose levels can often stabilize when we deal with the depression component. And it can lead to an improvement in quality of life. If there are physical causes of depression, we can treat it alongside with the diabetes. If there is no physical cause, it is likely that you'll be referred to a specialist. So it could be a psychologist, psychiatrist, a psychiatric nurse, or a professional counselor. ¿Por qué es tan importante comunicarse con su proveedor de salud para tratar la depresión? Para hablar cómo se siente, para encontrar una solución lo más antes posible. Dado que la diabetes mal controlada puede causar síntomas similares o los síntomas de la depresión, es importante hablar, no diagnosticarse uno mismo para ver qué hay entre manos. Los niveles de glucosa en sangre a menudo se estabilizan cuando manejamos la depresión junto con la diabetes y puede mejorar la calidad de vida. Si hay una causa física de la depresión, su proveedor de salud puede identificarla y tratarla lo más antes posible. Si no hay causa física, es probable que será referido o referida a un especialista. Puede ser psicólogo, psiquiatra, enfermero de psiquiatría o consejero profesional. So treatment for depression, talking, psychotherapy, counseling, helpful to talk to someone else that is objective, that's not so close to you, like a friend or a family member, and is trained and can offer new insights on what's happening in your life. Counseling can teach you different ways to deal with stress in your daily life. A well-trained professional can help you with depression-associated challenges, and you should feel comfortable with the counselor that you choose. Tratamiento para depresión, otra vez, hablar. Es útil hablar sobre sus problemas con una persona que pueda ser objetivo, que no es un familiar, amigo, amiga, que es entrenado, especializado en este tipo de consejería para ofrecer nuevas ideas sobre lo que está sucediendo en nuestras vidas con depresión. Debes de sentirse cómodo con el consejero que elige. Medications. Sometimes medications are necessary to treat depression. If they are an option and something that you will embark on, there are several classes. It does take, sometimes you have to take different ones when one doesn't work. And it does take time to work when you are on one. It may take 4 to 6 weeks before you feel the effects. And it's important to stick to it and work with your provider. So a veces los medicamentos son necesarios para el tratamiento de depresión. Si usted decide tomarlas, hay varias clases de medicamentos para depresión y a veces es necesario probar diferentes cuando uno no funciona, tratar otras. Si duran tiempo para funcionar, puede ser 4 a 6 semanas antes que empiece a sentir alguna diferencia. Por eso es importante trabajar con su proveedor de salud. Again, medications, it takes several weeks to work, may improve how you feel. It should not be stopped abruptly. These medications are working on receptors that it's important to have them weaned off. Discuss medication side effects. That's both for diabetes and depression medications, and how the depression medications can affect your blood sugar levels and your weight. Because some of them do. Otra vez, con los medicamentos para depresión, la mayoría toman semanas para comenzar a funcionar y no debe de suspenderse abruptamente. Estas medicinas trabajan en receptores en su cuerpo, que es importante disminuir la medicina al paso con su proveedor. Hable con su proveedor sobre efectos secundarios de los medicamentos, sea de depresión, sea de diabetes, pero exclusivamente con las de depresión. Pregunta cómo puede afectar sus niveles de glucosa y su peso, porque sí pueden afectar. Remember, in the treatment for depression, if you have symptoms, do not wait, seek help. If it's left untreated, it gets worse. And the sooner it is treated, the better the results are. As depression gets better, we tend to see improved control in diabetes because you're able to better engage and perform those necessary tasks for treatment. Tratamiento para la depresión, recuerde que si tiene síntomas, no espere, busque ayuda. Lo más antes posible que se trata, mejores son los resultados. A medida que la depresión va mejorando, vemos normalmente control en diabetes también. Y porque la persona porque están en mejores condiciones para realizar las tareas necesarias diarias para el tratamiento. Additional strategies, turn to your loved ones, people that you feel comfortable talking to. Find support. Physical activity is a big help. Exercising can make you feel better, both when you're depressed and also when you are feeling better. Take control of your illness with affirming positive thoughts. Your illness is not something clinical and separate from you that you cannot control. It is manageable, and it's good to find a partnership with healthcare providers and others who can help you through it. Your behavior and emotions play a very important role. You have control over your health. Estrategias adicionales, convierta a sus seres queridos en aliados, sean amistades, alguien en el cual usted confía. La actividad física es de gran ayuda, sea para ayudarlo a sentirse mejor, y igualmente cuando se siente mejor, continuar ese sentido de bienestar. Tomar el control de tu enfermedad con pensamientos afirmativos, positivos. Su enfermedad no es algo clínico y separado de usted que no puede controlar. Sí se puede manejar. Su comportamiento y emociones juegan un papel importante. Y tienes control sobre su salud. Debes de tomar control sobre su salud con ayuda. Alternative treatments, tratamientos alternativos, journaling. This is very big now. I know it says you can do this daily, but the latest studies have shown at least 3 times per week. Write down your experiences. It's better to do it as it's happening. And feelings only for you to read. This is private. We often say even place a password on your computer. This is something personal. Review your notes at the end of the day and try to understand why you felt that way you did at that moment. And sometimes you'll find correlations. You'll say, oh, I felt this way, and then the first thing I did was I grabbed a bag of potato chips. And it's sort of like now you start relating, okay, because that was a comfort food for me. And then you can identify it and you can become more aware of your emotions and how factors influence how you feel and how you respond. And there have been positive results in blood sugar control and mental health in terms of the journaling. Exercise your mind. You can use relaxation techniques, yoga, meditation, massage, keeping active, eat healthy and living a healthy lifestyle. Tratamientos alternativos que puedes utilizar para manejar la depresión y ayudar su diabetes. Un diario, mantener un diario. Ha salido recientemente en la literatura. Puede ser diariamente, pero yo he visto que por lo menos 3 veces a la semana documentar su experiencia, sus sentimientos. En ese momento es mejor documentarlos y es privado, completamente privado. Hasta he visto palabras claves en la computadora para que otras personas no los leas. Es para así propio, propia. Es revisar esas notas al final del día. Quizás usted identifica, me sentí mal en este momento y de una vez agarré palomitas de maíz, carbohidratos, sea papitas, y a través de entender cómo se sintió en ese momento y cómo usted manejó, puede ver, oh, ya entiendo, quizá hice eso porque esa comida me proveyó síntomas de confort, de sentirme mejor en ese momento, y puede quizás lidiar diferentemente la próxima vez. Se ha visto control de diabetes positivos y salud mental mejorar a través de mantener diarios. También puede ejercitar su mente, utilizar técnicas de relajación, yoga, meditación, masajes, mantenerse activo, comer sano y vivir un estilo de vida saludable. Just wanted to know if there are any questions at this time.
If you have any questions, you can use the chat function at the bottom and you can send the questions to me and I'll read them out. Si tienen preguntas, usen la función de chat en la parte de abajo y nosotros vamos a responder. There was a quick question. If you could do a small summary of the treatment for depression.
Yes, so I don't go into specific treatment. So depression, definitely seeking out a healthcare provider, because it may not require medications, but definitely would benefit from some kind of psychologist, psychiatrist, mental health counselor, just even having the conversation. So really, I'm on more the conservative side, so initial treatments, depending where you are in your depression. If someone has waited too long, or it's just an acute episode where they really need to be hospitalized, there's a broad spectrum of where someone can be in depression. But as far as treatment, that depends where you are at the point in time where your depression is. So if I want to generalize, I will say that it's more along the lines of conservative treatment, meeting with someone to talk about the depression and what's going on, and medication if necessary, and hospitalization, again, if necessary, if it's to the point where someone has completely lost the ability to function altogether and bathe themselves and feed themselves to the point where there are electrolyte metabolic disturbances that really requires hospitalization. So la pregunta fue, ¿cuál es el tratamiento de depresión? En sumario, estaba mencionando que depresión puede depender de cómo la persona presenta. Una persona puede, no sé a dónde estén en su depresión, puede ser mínima, no quiero minimalizarlo, pero puede ser que no está afectando su vida diaria, hasta el punto que una persona quizá no esté bañando, no esté comiendo, ya hay cambios metabólicos que realmente necesitan hospitalización, pero si queremos generalizar, empieza todo con una conversación. Puede ser un psicólogo, psiquiatra, consejero, y hablar sobre lo que está sucediendo y añadir medicamentos para depresión si es necesario, hasta la hospitalización si es necesario. No quería específicamente hablar sobre las medicinas, cuáles, porque eso es bien individualizado y debe de ser, debe de hablar con su proveedor de salud a ver lo que es mejor para usted dependiendo a dónde usted está.
I have another question. Please explain the role of cortisol and diabetes.
Yes, so I even was reading an article that came out yesterday. This is constant. So I want to separate for a moment cortisol and diabetes, because cortisol is a normal hormone in the body that we all have. And this comes up in response to stress. It's necessary for cortisol to come up because there are other functions that it has that helps us and our bodies in that moment to address that stressor that we're experiencing. So in diabetes, we did find that people had there is, like you can see in response to stress, cortisol goes up, but it's been found in studies that there are some people that have constantly cortisol levels that are like at a constant level that's affecting someone's metabolic profile, and that means diabetes. So having I wouldn't say high all of the time, but somewhat elevated, more than normal, persistent cortisol levels throughout is a risk factor and is seen in people with diabetes. And it is known that cortisol shuts your body sensitivity down to use insulin effectively. So it's just knowing the role of cortisol, what it normally does, and we do find persistent levels in people with diabetes, and in turn decrease insulin sensitivity, which increases blood glucose levels. So la pregunta fue el rolo de cortisol con diabetes, y yo quería mencionar que cortisol es una hormona normal en todos los seres humanos, es como el cuerpo responde a una situación de estrés, y ayuda a manejar en el sistema fisiológico ese estrés. Hemos visto que en personas con diabetes se encuentran esos niveles, no voy a decir drásticamente elevados, pero persistentemente suspendidos en una situación que teniendo esos niveles de cortisol persistente en el sistema contribuyen a resistencia a la insulina, y eso causa que incremente la azúcar. Y no quiero ir demasiado en detalle, pero también hemos visto, siempre algo respuesta larga, pero pueden ver hasta mujeres embarazadas con estrés, mucho estrés y depresión, sin diabetes, con cortisol elevados. En depresión y en estrés también se elevan el cortisol, y se ve muchas veces que bebé nace antes de lo que está supuesto. So I just also mentioned that as an aside, so you can see the relationship. It has been found like in pregnant women with depression, elevated levels of cortisol. So elevated levels of cortisol can be in depression, it can be in stress as well. And they have found early birth, earlier preterm birth in moms with depression and elevated cortisol levels. So I hope I answered the question. If not, ask again. Yes. Any other questions?
Do you want to keep going, and then we'll answer the rest of the questions at the end?
So that was the
okay. Then there is a question then. If you could explain the role of cortisol, that the role that cortisol plays with fat production.
Yeah. So again, we do find that cortisol helps with fat deposit. Again, so it's part of that fight or flight. Physiologically, what the cortisol is supposed to do just in the moment of stress, like I said, there are changes physiologically that occur in that moment, so your body can deal with that stressor. And persistent cortisol results in more fatty deposits, and in turn is associated with larger waist circumference, which in turn is a risk factor for diabetes. So otra vez la pregunta fue cómo está relacionado el cortisol y la grasa, el depósito de grasa en el cuerpo. El cortisol se eleva otra vez en momentos de estrés, de depresión, y tiene su rol en el cuerpo. Fisiológicamente debe de ser y existe en ese momento de estrés, pero cuando se mantiene persistentemente elevado, sí contribuye al depósito de grasa en el cuerpo y de aumento del tamaño de la circunferencia de la cintura, que en torno es un riesgo para diabetes. It's just one of those metabolic changes that occur with cortisol, increased fat deposit.
I have another question. Does the fat dissolve eventually, or does it deposit elsewhere?
Oh, so I mean, I don't see that. I haven't read in reports that the cortisol discriminate, just basically it goes to your waist. That's not it. It is just fatty deposit that's generalized. So it's not like it's just cortisol is contributing to fat deposit in your waist. It's more generalized. Now, as far as removing that stressor or addressing the elevated cortisol, in terms of getting rid of fat deposits, again, this goes back to the beginning when we were going to the medication management, where if it's not something that from resolving that stressor, the cortisol and everything, there should be, you can manage it by, again, depending on your nutritional intake, as far as fats, exercise activity, also the medications. Like I mentioned, there are some medications that have been found to decrease, whether it's, again, the epicardial fat, the liver fat, TZDs. It's a family of medications for diabetes that helps with that. And they have also found most recently with SGLT2 inhibitors that it helps with fat deposits in decreasing. La pregunta, I'm sorry, Kenny, if you can say it again so I can say it in Spanish, the question, or the fat deposits. So otra vez la pregunta era, los depósitos de grasa, si se pueden eliminar o estamos hablando sobre la cintura. La grasa no es solo depositado con cortisol elevado en la cintura, es más generalizado y otra vez eso, regresando a la conversación antemano de las medicinas, que fue otra parte, de otra presentación de diabetes, además de comer con grasas controladas, el ejercicio, sí hay medicinas para disminuir las capas de grasas, sí es relacionado al problema de diabetes y se ha visto con la familia que se llama TZD, que son como pioglitazone, Actos, esas medicinas, y también SGLT2, que son las invocanas, Jardians, esas medicinas que sí han visto disminuir las grasas en el cuerpo depositados en órganos, por ejemplo.
I'm going to start the poll. All your answers will be anonymous. Voy a comenzar la encuesta y todo, las respuestas van a ser anónimas, ¿ok?
Oh, go ahead.
While you're doing the poll, you can still send in the questions that you want to have answers, and you can go ahead, Ruben.
Sure, and I just wanted to provide some resources for you here. The first one includes a great pamphlet on, you can see their depression and diabetes. There is a link there for a mental health provider list that they specifically have the certification of diabetes education with mental health. And these are people that can really help you, especially if you're someone with diabetes who's testing 10, 15, 20 times per day, and you're really stressed about your diabetes, and you may realize that you may just need to speak to someone and see if it really is an issue or not. Also, NYC Well, this is for everyone, diabetes or not. Just to talk to someone, it's free, confidential mental health support in New York City. And you have the information there. You have Spanish, Chinese, English websites that you can go to for the same information. And just a national US, the National Mental Health helpline. And again, at the end, another just nice short depression and diabetes information handout. So you can review and see if possibly this is affecting you personally, or even provide this information to someone that you think may benefit from it. And Kenny, I believe, will be uploading this presentation on YouTube, so you can always refer back to it. So you don't have to write all of this down.
I have also sent the link through chat. I have a question. Do you think that a therapy will help me to control more my diabetes, because medicine looks like it's not controlling it?
Yes, so I always find, I always say, if, it isn't, I'm offering a free resource here, but if you're able to afford it, if not, definitely use the free helpline. It, I would say, I'm not going to say never, because I don't like to use that word, but it doesn't hurt to speak to someone just to see if it's a possibility that there's something associated with mental health, with just your state of mind and accepting the diagnosis. It helps to talk to someone who's not a family or a friend who can judge or nitpick or kind of know too much about you to maybe provide a skewed sense of what's going on. It's good to have an objective mind, and I often find that healthcare providers, and especially in primary care, they simply, through no fault of their own, some of them do not have the time to sit and discuss your mental health piece in relation to the medication piece. So if your provider is not able to do that, I would suggest that you at least talk it over with a mental health professional, even if it's one session, to see what's going on. I definitely don't want to generalize why someone's blood sugar control is not controlled based on their current regimen. La pregunta fue si yo tengo diabetes, mi azúcar está descontrolada el régimen que tengo en este momento, ¿debo de ver una persona de salud sobre mi salud mental? Mi respuesta fue que es importante, se debe de hacer, no hay nada que se puede perder en hacerlo. Sin embargo, es bueno tener una persona con una objetividad diferente, que no sea amistad o familiar, que no sepa todo sobre usted, que quizá le dé un consejo o un punto de vista que en realidad no es objetivo. So, si puedes, igualmente como debe de ver un nutricionista, aunque quizá usted sepa todo lo que debe de comer para manejar su diabetes, como quiera debe de verlo, porque es importante tener ideas y estrategias como manejar su dieta, igualmente su salud mental. Es importante hablar con alguien y solo ver si en realidad hay algo ahí o no. No quería generalizar sobre el control de diabetes en alguien y su régimen personal, porque en realidad no sé todo completo sobre esa persona. Y finalmente, quería decir que su salud, su proveedor de salud, su médico de cabecera, su enfermero, quizá no tenga el tiempo para hablar con usted sobre otras cosas, solo las medicinas. Entonces, si no tienen ese tiempo, puede hablar con un consejero. Es importante. Another question?
Just a second. I will be sending out the YouTube link again. This will be uploaded within the next 24 hours. All right. Can you recommend? This is I'm not sure if you could answer this question. Can you recommend someone who can help me? My doctor wants me to do surgery and I don't want that.
So, as far as I know, in terms of surgery, that is, again, it's a general question. I always go back to your primary care provider, who's the person that manages your entire care. So it's important to have a primary care person, someone who is helping as a resource and managing all of the providers that you're working with. So I would say, if anything, if you have any doubt, go back to that person and discuss what's going on, what type of surgery it is, the reasons, and sort of work out that whole picture of whether it's necessary for you or not. Most importantly, the risks and benefits of the surgery. it's important to discuss, because if you're doing surgery, it has to meet your expectations of how you want to live out your life based on what the surgery is for, what your quality of life is and will be. What do you want? How do you want to live? Alguien preguntó una pregunta general sobre cirugía, que me estaban diciendo que me dicen que debo de tener cirugía, pero no la quiero tener. Solo quería decir que es importante por eso tener una persona, un médico de cabecera, que maneje todo su cuidado, ser como un gerente entre todas las otras disciplinas, y debe de hablar con esa persona y hablar sobre la diagnosis, cuál es la cirugía, para qué es, y principalmente saber los beneficios y los riesgos de esa cirugía, porque al final lo que se debe usted mismo contestar es cuál es mi calidad de vida, tener o no tener esta cirugía, cómo yo quiero vivir mi vida. Eso es importante tener esa conversación. So that's the broad answer to that type of a question that I feel is important to address. That risk and benefits thing, your autonomy, all of that is very, very important in how you want to live your life.
Ruben, is it possible for you to go back one, where our contact information is? Yes, for the links, I will add it to our YouTube video, but you can also email me and I will send you the links as well for the resources, okay? I do not think we have any more questions. So I think we'll end the presentation here. Thank you very much, Ruben, today, for today. And thank you everyone for coming today as well. Our next presentation, I will send out an email with our next presentation. It will probably be in the next 2 or 3 weeks, but I'll send out the email.
Thank you very much.
Thank you, Ruben. Bye-bye. Bye-bye, everyone.